Hi everyone, this is Dr. Alex Ehsan, and I'm an oncologist and a hematologist. I'd like to speak to you today about diffuse large B-cell lymphoma, which is the most common lymphoma that can often be cured. Uh, it is one of those cancers that can change someone's life overnight. And I'll give you a scenario of a patient of mine. This gentleman was 55 years old. He's a father of three, had a painless lump on the side of his neck. At first he thought he had a cold, let it go a couple of weeks, and ultimately in about a month or so he started waking up soaked in sweat, and he just didn't feel good. He started losing weight. He kept on feeling more tired and tired as time went on, and eventually his family convinced him to go see his primary care doctor. Luckily, they ordered a CT scan and they biopsied the lymph node that had gotten enlarged, and the diagnosis came back diffuse large B-cell lymphoma. For many people, obviously, lymphoma is a terrifying sound, just hearing the word. But the good news is diffuse large B-cell lymphoma is one of the most treatable and potentially curable cancers that oncologists see. And I'm going to walk you through it, so hopefully this will help you. I always make sure that the excisional biopsy that we have, meaning the tissue that has been taken out of a patient in form of a biopsy, undergoes genetic testing, and we do what's called immunohistochemistry to make sure that the subtype of the lymphoma is correct. And to be very blunt, I always do a PET scan, and I think this is incredibly important because lymphoma cells use large amount of sugar, and using a PET scan allows me to highlight the areas where the lymphoma may be. And therefore, if the lymphoma, for instance, is above the belly button and below the belly button or even the bones, we end up knowing exactly where we're starting, and then we'll know exactly where we need to go next. In almost everybody, we do a bone marrow biopsy, and that's simply because lymphoma cells in the bone marrow can give us a lot more information about what type of cells we're dealing with, and it also helps us with the prognosis. What is important in case of lymphoma is really the age of a patient, how much can they do, which is what we call performance status, and what part of the body is involved. A simple blood test called LDH typically helps us figure out the aggressiveness of this lymphoma. And the most common chemotherapy regimen that's standardized today is called R-CHOP chemotherapy. And before we give anyone the R or the Rituxan, we always make sure that they're checked for hepatitis. We give everybody a medicine to block uric acid intake called allopurinol, because getting gout from the cells that are dying as we start treating a patient is quite common. The lymphomas these days are really quite exciting for oncologists because we have treatments that are based on biological treatments, such as polatuzumab-based therapy. We now have medications including CAR T-cell therapy, bispecific antibodies that can attack the lymphomas, and clinical trials are incredibly useful and available. During the treatment of lymphoma, we always make sure that We address your nutrition, your emotional well-being. We check your blood count. I typically do a scan to know the function of your heart. This is called an echocardiogram. And having done this for over 20 years, I always tell my patients all lymphomas are different, but the fact that you're willing to come and see an oncologist and hear us out is the uh, half of the difficult part. So once we have a diagnosis of a lymphoma based on a biopsy, then we have a PET scan to localize and stage the lymphoma. Then we do a bone marrow biopsy to see where the lymphoma is. At times we have to do a lumbar puncture, especially if we have a mesenteric lymphoma or a testicular lymphoma, for instance. And if the lymphoma is more aggressive, based on the testing that we do, uh, in addition to the basic bone marrow and the PET, we could do next generation sequencing, chromosomal testing, and I have remained quite optimistic because honestly, nowadays, many of my patients return to work once they're done with their treatment. They have birthdays again, normal life, and my mission is really to help patients understand what diffuse large B-cell lymphoma and other types of cancers are, and my hope is to replace fear and uncertainty with knowledge. Uh, I will write this out so you have a good description of what lymphoma is and you can go back to it. And I hope that this is something that's useful for you. And if you are my patient, I look forward to seeing you this month. If you're not, I hope I never see you, which basically means you don't have cancer that needs to be treated, or a blood disorder for that matter. Best of luck, God bless, and look forward to hearing back from you if you found this little video useful.